professor, physician, epidemiologist. I am Dr. Sri Banerjee. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'm going to just briefly go over the main components of the Transtheoretical model and the stages of change. The Transtheoretical model has been around for a long time. I was classically trained within this model, within this framework, in how to conduct interviews with patients and how to better establish that patient-physician relationship. And I'm going to go through the specifics of this model to show you specifically how this can really help aid in communicating with your patient or client, but also you can use this to gauge where they stand within the readiness to change. And then based on that specific readiness to change, you can apply the model to get them thinking about the next stage. So it's a very systematic sort of approach to understanding all of the phases of change, but also very tailored interventions, for lack of a better term, to try to understand specifically what level of change the client or the patient is in, and then getting them to that next level. So, of course, as we're thinking, we're moving, just a point of caution here, we're moving downward as we're moving through the stages of change, but anytime there is a moving backwards, then that would be considered relapse. So just specifically, what do all these stages of change mean? Well, going from all the way from pre-contemplation to contemplation, preparation, action, and maintenance, we go from taking the client from thinking about change within the next 6 months, which is contemplation. We take clients from where they might not be even considering change, from pre-contemplation, to all the way to maintenance, where people have been already within that new modality of change and has been there for 6 months. So it's all the way from pre-contemplation to maintenance, and making sure that once the client or the patient, once they kick the habit, that it actually remains that way. And so that's kind of in layman's terms, but the idea is to not relapse from addictions. So on the right-hand side, what I have provided is kind of a layperson indication of what the left-hand side means. So pre-contemplation basically means no. Client's not ready to change. If you're talking about quitting tobacco smoking, then client is not ready to change. Going from no to maybe, that's quite a challenge. So sometimes you have to tell the patient that, they might not be ready to listen to what you're saying. Here's some literature, and in the next visit, maybe we can talk more. From there to maybe, to prepare and plan. So from there, no, not at all, to yes, within the next month, I have a concrete plan to change and to quit. And so from there to getting them to do and then keep going. That is how this model works. And as you're urging clients and patients to get from one stage to the next, in the meantime, you're using motivational interviewing to kind of help propel them into a kind of behavior change. So this really summarizes all the major and necessary components of the trans-theoretical model stages of change. Thank you for listening.